Hi friends, this is Riddhi Joshi and today I am going to talk about burns. Let's see the layer of skin. Why we are learning this layer of skin? Because in order to learn burns, we need to know about the layer of skin. So we can see that which degree of the burn is there. So this is the first layer of our skin. It is known as epidermis. This is the outermost layer of skin which provides a waterproof barrier and creates our skin tone. This is made up of squamous epithelium. The next layer is dermis. It is beneath the epidermis and it contains tough connective tissue, sebaceous gland and sweat glands, hair follicles, etc. The deeper subcutaneous tissue, this is the deeper subcutaneous tissue. This is known as hypodermis. This is made up of fat and connective tissue. This is subcutaneous tissue. This is made up of fat and connective tissue. Let's see the layer of epidermis. It is stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum and stratum basal. So first we are going to see about the stratum basal. It is consist of single layer of stem cells and keratinocyte, that is resting on the basement membrane. Second is stratum spinosum. So it is a consist of this is stratum spinosum. So it is consist of several layers of keratinocytes and it is the thickest stratum in most of the skin. Now we are going to see about the stratum granulosum. So it consists of 3 to 5 layers of flat keratinocyte. It contains dark staining granules. Now we are going to see about the stratum lucidum. So it's seen only in thick skin. It contains keratinocytes and they are packed in closely together. We can see here they are packed in closely together. Last one is stratum corneum. It is consist up to 30 layer of dead scaly cells that are they form a durable surface layer. So this layer is specially resistant to the abrasion, penetration and water loss. Now we are going to see about the layers of dermis. There are two layers of dermis, papillary dermis and reticular dermis. In the layer of dermis, the papillary dermis is rich in the small blood vessels. So it has a loose areolar connective tissue and especially we can see in the palm, fingers, soles and toes, that is influencing some papillary projection into the epidermis. The second layer is reticular dermis. So it is made up of collagen and elastic reticular fibers. So it provides like elasticity to your elasticity and extensibility to our skin. Now we are going to see about the hypodermis. The hypodermis it contains the adipose tissue and muscles. It is consist of loose connective tissue, adipose tissue and elastin. The main cell type is fibroblast and macrophages plus adipocytes. The fat serve as a padding and insulation for our body. Let's see the function of skin. Skin provides us the protection like from infection. It provides sensation like nerve endings that react to hot or cold. For an example, if we are touching to hot flame, so we will immediately take our hands off. So it is due to sensation. Then heat regulation. It controls the energy loss by radiation, convection and conduction. Mainly the control of evaporation, excretion by the sweat gland, absorption and water resistance. So these all are the functions of our skin. Now we are going to see about degrees of burns. Let's have a look on it. This is first degree burn, second degree burn and third degree burn. So first degree burn, it involves epidermis and upper layer of dermis. The second degree burn, it will involve the epidermis and lower layer of dermis. So in second degree burn, affect the lower layer of skin that cause pain, redness, swelling, blistering. It involves the sebaceous gland, sweat gland, hair follicles, nerve ending, etc. In third degree burn or full thickness burn, we can see that it is go into the depth. So it will involve the subcutaneous tissue. It destroys everything. It goes through dermis, affect the deeper tissues, which result in the white, black and or charred skin. It may get numb because our nerve endings are destroyed. Subcutaneous fat and muscles are also involved in this. Now we are going to see about burns classification. So we are going to see stages of the burns, description and how it heals. In stage 1, it calls superficial burns. It involves epidermis or outer dermis only. So the skin is just erythematous pink or red color. Because irritated dermis, no blisters, dry surface, delayed pain and tender. Healing occurs through minimal edema. Fast healing is there. There is no scar. We can see this. No scar. It will heal within 3 to 5 days. Let's see stage 2 or superficial partial thickness burn. In superficial partial thickness burn, it will look like bright pink or red color, mottled red color. Because here we can see this inflamed dermis with erythematous blanching and capillary refill is there. Here the blister is intact. Moist surface, weeping or glistering surface. It is sensitive to change in temperature, very painful. It involves epidermis and upper portion of dermis. Healing occurs through minimum or no scarring. It heals within 5 to 21 days. Let's have a look on stage 3 or deep partial thickness burn. This deep partial thickness burn, it involves epidermis and majority of dermis. So mix red color or waxy white color appearance. Blanching with slow capillary refill. The broken blisters, see here we can see that the blister is broken. That's why this is a wet surface and it is very sensitive to pressure but insensitive to light touch or soft pin prick. Discolored broken blisters damage nerve ending leads to moderate pain. Here healing occurs through hypertrophic or keloid scarring. In absence of infection, healing occurs within 21 to 35 days. Let's have a look on stage 4 or full thickness burn. This is third degree burn, destroy all skin layer including underlying subcutaneous fat. It looks like white ischemic or charred tan, black or red color. No blanching, poor circulation, parchment like leathery and rigid or dry. This wound often requires skin graft and can result in contractures. Heals with grafting, scarring and it takes months to heal. Let's have a look on stage 5. This is subdermal burn. This is 4th degree burn, destroy all skin layers, extend to muscle, tendon or bone. In this diagram we can see that it is reached up to our bone. So this is black charred, eschar charred or subcutaneous tissue with anesthetic or muscle damage is there. Here nerve ending is also involved, so neurological involvement is also there. Healing, here severe functional impairment is there and this is irreversible, so amputation is required. Let's see the burns wound zone. Zone of hyperemia means minimal cell damage and tissue recover within several days. In zone of stress is cell death within 24 to 48 hours without the treatment. And zone of coagulation, there is irreversible cell damage and that require the skin graft. Let's see the wound terminology. What is abrasion? The abrasion is removal of epidermis or upper dermis due to mechanical force such as a friction or trauma. Let's see debridement. Debridement means removal of devitalized tissue, cellular debris or any foreign matter from wound. What is dehiscence? It's separation of surgically approximated layer of an operative wound. Let's see the eschar. So it is thick leathery black, brown or grey necrotic devitalized tissue on surface of wound. It may be firmly adhered or partially separated from surrounding viable wound margins. What is excoriation? It is disruption of epidermis or dermis caused by scratching, abrasion, chemical or thermal injury. Let's see the exudate. Exudate means fluid release from the tissue or capillaries, usually due to injury or inflammation. If there is injury or inflammation, it released from the tissue or capillaries. It is characteristically high in protein and WBC means white blood cells. Let's continue with the other wound terminologies. Induration. Induration means abnormal hardening of tissues, especially in skin and superficial fascia, which is caused by congestion, edema or inflammation. Indolent means inactive, not developing, slow to heal, little or no pain. What is maceration? Maceration means moistening. So the change is subsequent disintegration of the skin results from prolonged exposure to the moisture. It looks like a white color in appearance. Let's see the sinus tract. Course or the path of tissue destruction occurring in any direction beneath the surface or edge of the wound. It can be distinguished from undermining by the fact that sinus tract involves small portion of the wound, whereas undermining involves significant or large portion of the wound edge. It also called as tract or tunneling. Let's see avulsion or degloving. Means serious wound results from tension that cause skin to detach from underlying structures. What is desiccated? Drying out or dehydration of the wound. It comes from poor dressing selection that doesn't evaporation of the wound bed moisture. Let's see desquamation. Peeling of outer layer of epidermis called desquamation. What is slough? It moist, stingy, mucus white or yellow color tissue loosely attached to the wound bed. What is laceration? Laceration means wound or irregular tear of tissue that associated with trauma. It occurs from shear, tension, high force compression, etc. What is erythema? Erythema means diffuse redness of the skin result from capillary dilatation and congestion or inflammation. Let's see the ecchymosis. Ecchymosis means discoloration of the skin from trauma or underlying blood vessels and seeping into the tissues. The discoloration look like blue-black, then it turn into the greenish brown to yellow color. The affected area of ecchymosis, also known as bruise. Let's see healing, wound healing. So first, hemostasis. It starts at the onset of injury when person stop bleeding. Platelet comes to the injured site, thrombin initiate the fibrin mesh and strengthen the platelet clump into the clot. This is hemostasis. The inflammatory phase is the first phase of the healing. In this, it destroys the bacteria, remove the debris with the help of the neutrophils. After 3 days, white blood cells leave and the macrophage will arrive. The macrophage will arrive and engulf the bacteria. It also secretes the growth factors and proteins that attract the immune cells to wound. So there will be facilitation of tissue repair. This phase lasts up to 4 to 6 days and is often associated with edema, erythema and heat and pain. Erythema means reddening of the skin. The second phase is proliferation phase. It lasts up to 3 days to 21 days. It is divided into 3 stages. First stage is filling the wound. Filling the wound. During this first stage, it will look like a shiny deep red granulation tissue that fills the wound bed with connective tissue and new blood vessels are formed. The second phase is contraction of the wound margin. During this, the contraction phase, the wound margins contract and pull toward the center of the wound. Pull toward the center of the wound. The third phase is covering the wound, means epithelialization. So epithelial cells arise from the wound bed or margin and begin to migrate across the wound bed, and leapfrog fashion, they will arise and cover the wound epithelium. Last phase is remodeling or maturation phase. This is remodeling and maturation phase. It lasts up to 7 days to 2 years. In this phase, new tissue slowly gains strength and flexibility. The collagen fibers remodel and mature the cells. It also increases the tensile strength. Let's see the healing by intention or union. The healing with the primary intention or union occur at the acute wound site. First, we need to clean the incision, then reapproximate with the sutures or staples or adhesive to facilitate the re-epithelialization. The superficial partial thickness wound like abrasion blisters will heal with the primary intention. It will complete in 72 hours. Let's see healing by secondary intention. It occurs in the open large tissue defect and close without superficial closure. We can see this gapping of the wound. Large tissue defect is there without any superficial closure, and here we can see the blood clot. There is significant tissue loss, necrosis, so we can't reapproximate it. Infection, debris and contamination are healed by secondary intention. Healing with more inflammation and granulation tissue forming and more scarring is there. There will be granulation tissue formation and more inflammation and more scarring is there when healing by secondary intention. Let's see the healing by tertiary intention. Healing by tertiary intention, also referred as delayed primary intention. The wound also have some chances of developing some complication. This is like contaminated wound, like sepsis, dehiscence, poor circulation to the injured area, or severe crush injury or infection in the wound. Wound healing by tertiary intention is an abdominal wound that initially left open to allow the drainage, but later it is closed and scar left. Here we can see that the granulation tissue formation is there and closure with the wide scar with help of sutures. Let's see the type of exudate. Serous, sanguineous, serosanguineous, seropurulent and purulent. First is serous. It looks like light color, clear, thin and watery consistency, seen in normal wound healing phase like inflammatory and proliferation phase. Second is sanguineous. It looks like red color, watery consistency, red due to presence of fresh blood in deep it will see in deep partial thickness or full thickness wounds. It indicated that new blood vessels grow or disruption of the blood vessels is there. Small amount is normal during the inflammatory stage. Serosanguineous, it looks like light red or pink in color with thin or watery consistency. Light red or pink in color with watery consistency. Seen in inflammatory or proliferative phase of healing. Seropurulent, it's cloudy opaque yellow tan color, watery consistency. It indicates infection, abnormal finding. Purulent means present with yellow or green color. It is thick, viscous consistency and it indicates infection with high bacterial level. Let's see burns percentage calculation for adult and children. So for adult, anteriorly, posteriorly, same way for children, anteriorly and posteriorly. Let's see for the adult. So if their face is burnt anteriorly, so it is only 4.5%, but if it is burnt from anterior and posteriorly, so collectively 4.5, so is equal to 9%. If anterior arm is burnt and posterior arm is burnt, so collectively 9%, means if anteriorly is burnt only 4.5, if posteriorly burnt only 4.5%. Then check for the anterior chest and abdomen. So it's collectively 9 plus 9, so 18 anteriorly, and for back, upper back, lower back, 9, 9, 18 collectively. So for whole leg it is 9% anteriorly and posteriorly 9% and collectively 18%. Let's see for the children. If their anterior face is burnt 8.5%, posterior face is burnt 8.5% and collectively 17%. If anterior arm is there, only 4.5%. If posterior is there, it is 4.5%, collectively 9%. For anterior chest and abdomen 18%, posterior chest and abdomen, posterior back and upper back and lower back, it is 18%. And the same way, like for anteriorly, if their legs is burnt, is 6.5% and posteriorly 6.5, so collectively 13%. So like this way burns percent calculation is there. So don't be get confused with 4.5 or 9%. Let's see what is undermining and tunneling. This is tunneling and this is undermining. So let's see first tunneling. It is measured by inserting a sterile cotton taped applicator into the tunnel and measuring the distance of insertion. Each tunnel is measured and documented separately. So this is called a tunneling. And undermining, it is measured with the same Q-tip, means sterile cotton tape applicator, and the undermining extends around the entire circumference of the wound. So although the extent of the undermining may vary, so like if it is in circular, so like this way they will measure the undermining, and for tunneling they measures the distance of insertion up to their tunnel. The undermining and tunnel, if we continue this, so gauge tunnel depth by determine how far you can insert your finger or foam tip device. If we notice necrosis, notify the wound care specialist. Choose an appropriate wound dressing. This is undermining and tunneling YouTube video. It may helpful for you guys. Now we are going to measure width, depth and length of the wound. This is width, length of the wound. So length, how we can measure? So for measurement of the length, first we need to remember that heels are always 12 o'clock position. Width measures perpendicular to the length. Place your ruler over the widest aspect of 9 o'clock for the width measurement, and for depth place a cotton tip applicator into the deep area. Let's see how to measure width, depth and length of the wound. For measuring the length of the wound, heels are always on 12 o'clock and the feet are always on 6 o'clock position. So first of all, if we want to measure the width, measure the perpendicular width to the length. Place your ruler over the widest aspect of the wound and measure from 3 o'clock to 9 o'clock position. So this is length, and perpendicular we are keeping the width, 3 o'clock to 9 o'clock position. In order to measure the depth, place a cotton tip applicator into the deepest part of the wound as we have seen in undermining and tunneling. Then grasp the applicator by wound margin and place it against the ruler. Let's see difference between macerated wound, slough and eschar. So how it will look, what is the characteristic of it? The macerated wound, it look like white color. Softening and breaking down of the skin results from the prolonged exposure to the moisture. It is caused by excessive amount of fluid remaining in the contact with skin or surface of the wound for longer period of the time. We can see the maceration in the peri-wound area. This is in white color. Let's see the slough. The moist, stingy, mucinous, white or yellow color tissue. White color or yellow color tissue. It will smell. That consists of fibrin, pus and proteinaceous material and loosely attached to the wound bed. We can see this. It is loosely attached to the wound bed. Slough can be found on the surface of a previously clean wound bed. It may be associated with the bacterial activity. Lastly, we are going to see the eschar. So it is black necrotic tissue. It may firmly adhere to the wound or partially separated from surrounding viable wound margins. We can see like this is partially separated from surrounding wound margins, and this is black color. What is the difference between keloid and hypertrophic scar? Let's see. The hypertrophic scar, it will red in color, raised in appearance and firm in the texture. So remember, red, raised and firm. So this is red color. We can see in this diagram, this is little bit raised and firm in texture. It stays within the boundaries. We can see this, like this is staying within the boundary. Let's see the keloid scar. This is very large, firm scar and overflows the boundary of original wound. It is common in Asians and Africans. So if we want to differentiate the hypertrophic and keloid scar, just remember red, raised, firm in texture, stays within the boundary is hypertrophic scar, but it is large and not remaining inside their boundaries, means it is coming out of their boundary, so that is keloid scar. What is difference between induration and excoriation? Let's have a look on that. Induration means abnormal hardening of tissue, especially the skin, and superficial fascia caused by congestion, edema, or inflammation. This increase in the fibrous element in the tissue commonly associated with the inflammation and markedly by loss of elasticity and pliability. Let's have a look for excoriation. Excoriation means disruption of epidermis or dermis caused by scratching, abrasion or chemical or else thermal injury. The abrated area where skin is torn or worn off.
Thanks for watching, and for future videos don't forget to subscribe. If you have any doubts related to topics in physical therapy exams, please let me know in my comment section so I can make a series of the videos on that. Till that time, stay positive. Bye bye.